Now, more than 2,000 refugees from DR Congo are living in terrible situation in Uganda, leaving the UN Refugees Agency worried of the situation amid surge in COVID-19 infections in the country. The East African nation is hosting over 1 million refugees from neighboring countries, including South Sudan, DR Congo, Somalia, and Burundi, many of whom could be exposed to growing number of new infections. As health workers deal with the devastating COVID-19 situation, more people, including refugees, are being vaccinated according to the United Nations Refugee Agency. Detail in this report.
The UN Refugee Agency says 2,500 people have crossed the border into Uganda. The refugees are stationed at a transit camp in the western districts of Bundibujo and Toroko. Most of them are in need of temporary relief items like food, blankets, and clean water. But there is fear of a possible spike in COVID-19 cases since some have already mingled with the local population.
UNHCR and its partners are going to provide assistance in line with the SOPs, that is testing of COVID, and putting them in a situation or in quarantine where they are not crowded, observing the spacing that is required. And we would like to applaud the government of Uganda that much as we are in the midst of a pandemic, they have been kind enough to open up and allow asylum seekers to come into the country.
Uganda is already home to 1.4 million refugees, mainly from South Sudan, the DR Congo, Burundi, Somalia, and Eritrea, among others. But as the country battles a more serious second wave of the COVID-19 pandemic, the situation is likely to get more complicated as refugee arrivals increase. A new report by the international aid agency World Vision shows that refugees and internally displaced persons face the highest risk of contracting COVID-19. But research carried out in 8 countries, including Uganda, reveals that refugees have been left out in the race for COVID-19 vaccines. Uganda is struggling to inoculate its own population. The country's health systems are overwhelmed by the rising cases of COVID-19, with only 800,000 people inoculated so far.
We believe refugees actually face the highest risk of facing COVID-19. So if there's any chance of getting vaccinated, it should be them actually on the top of the list. These are people who live in very confined places, in very small spaces, in their makeshift shelters where they have to pile up.
But the UN Refugee Agency says the vaccination program in Uganda includes refugees and citizens. UNHCR says some refugees in priority groups that the government announced have received the jab.
As we speak, during the first batch of vaccines that Uganda received, we had 3,905 refugees that received vaccination in the different parts of the country. But as you know, it's voluntary. But however, those who wanted to get vaccinated did receive the vaccines alongside the nationals.
Uganda has an open door policy for refugees. The country allows asylum seekers to move freely, work, go to school, and access healthcare services like any Ugandan citizen.